Hand hygiene. Hi, my name is Batul Sapsabi and I'm currently enrolled in healthcare environments, and this is part B to the week 12 reflection. Hand hygiene is the single most important factor in reducing hospital-acquired infections and has been nominated as a priority area by the Australian Commission on Safety and Quality in Healthcare. Keeping hands clean through improved hand hygiene is one of the most important steps we can take to avoid getting sick and spreading germs to others. Many diseases and conditions are spread by not washing hands with soap and clean running water. Hand Hygiene Australia has established a consistent best practice application for hand hygiene referred to the 5 moments for hand hygiene, as well as education and auditing within both public and private hospitals throughout Australia. The World Health Organization has identified and developed the My 5 Moments for Hand Hygiene approach, which defines the key moments of when healthcare workers should perform hand hygiene. 1. Before touching a patient. 2. Before clean procedures. 3. After body fluid exposure or risk. 4. After touching a patient. And 5. After touching a patient's surroundings. Washing your hands properly can help prevent the spread of germs like bacteria and viruses that cause these diseases. It is an important hygiene measure in preventing the spread of infection. It is the most cost-effective investment in public health, and the economic benefit from hand washing is not unique to the prevention of diarrhea and pneumonia, but also most healthcare-associated infections, which are extremely costly to individuals, healthcare systems, and countries. Hand washing halts the spread of infection and is effective in preventing the spread of some diseases. If hands are not clean, simple activities such as placing a finger in the mouth, rubbing your nose or eye, may transmit enough germs to the body to cause an infection or disease such as hepatitis A or noroviruses. Hand washing compliance rates are being inflated by as much as 30%, and Australian infection control expert says, which could be put in patients at risk of the spread of disease. During 2005 to 2015, the number of global deaths are associated with unsafe water and no hand washing with soap fell more than 12%. How to properly wash your hands. First, remove your jewelry. 2. Use pump liquid soap. 3. Avoid touching the sink. 4. Wet hands thoroughly with warm water. 5. Lather hands with soap and vigorously rub together, making sure all surfaces of the hands are covered for approximately 20 seconds. 6. Rinse thoroughly under a moderate stream of water. 7. Dry thoroughly. And 8. Turn off the tap with a dry paper towel. Nearly 1.4 million children under the age of 5 die from diarrhea diseases and pneumonia, the top 2 killers of young people around the world. Hand washing with soap could prevent about 1 out of every 6 episodes of diarrhea illnesses and almost 1 out of 6 episodes of respiratory infections like pneumonia. Washing our hands with soap is the best way to reduce the number of microbes on them in most situations. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% of alcohol. The alcohol works immediately and effectively in order to kill bacteria and most viruses. How to use a hand sanitizer. Apply a palm full of product and rub vigorously for 20 to 30 seconds, making sure to distribute the sanitizer between your fingers, under your nails and jewelry, on your wrists and on the back of each hand. When your hands are dry, you are good to go. Thank you.